All right, so it's my pleasure to speak with you today about some ways a health-literate approach to communication can help create a more humane healthcare system and better results for all patients. But I'm going to talk especially about older adults today, like Jim. So I'm hoping I can give you some food for thought that we can discuss later on, and I'm looking forward to your questions. So 93 million American adults lack health literacy skills to understand and use health information and navigate the healthcare system. So 93 million people, so about a quarter of the US population, is struggling to use the healthcare system that is designed to help them live long, healthy, active lives. So why is low health literacy so important? Well, it means that these 93 million American adults lack the skills or support to do really basic things like read and understand complex health information, make decisions about risks, such as whether to get a flu shot, how to manage a chronic condition like diabetes or hypertension, or understand and act on a diagnosis like colon or lung cancer. So health literacy can affect anyone, but there are several populations that are more vulnerable to health or limited health literacy. So folks with lower income levels, people with lower education levels, people with limited English proficiency, individuals with serious mental illness, and maybe most importantly for me for today's conversation, the elderly and older adults. So barriers to clear communication exist everywhere, every day, and at every level, and they have an effect on patients, providers, and the healthcare system, which I suspect everyone in here has experienced. So whether it's patient emotions, provider jargon, or systemic complexity, the cared for are often pushed out of the center of health and wellness conversations. So in order to provide better care to everyone, including older adults, we need to make sure that healthcare providers and other professionals are earning the respect and trust of the population, which means demonstrating cultural humility and striving to understand the cultural, social, and emotional values that drive patient attitudes or behaviors about health. So the evidence shows that building positive relationships with patients helps them feel caregivers value them as people, which then leads those people to better follow healthcare instructions, which not surprisingly increases patient satisfaction, but also patient health, all important goals within our healthcare system. So I'm going to start today by talking about some concrete ways to build relationships and enhance the humanity of older adult care. So, for example, providers need more training in how to create a patient-friendly environment for older adults. For example, speaking speed should be that of an audiobook, and providers need to know that just speaking louder or very slowly doesn't improve patient comprehension and actually creates anxiety. Providers also need more training on how to ask good questions. More than that, they need to be willing to listen to the answers. Most people are really poor active listeners, but in the case of healthcare providers, this can have dire consequences. Active listening is about avoiding judgment, it's not about checking boxes, and it can save lives. Most providers and institutions would also benefit from an increased understanding of accessibility and accessibility services available. Even basic elements like closed captioning make educational video content more usable for older adults with hearing loss, and materials designed for use with a screen reader can make written material available to an older adult with glaucoma or other vision issues. Maybe most importantly, never assume what support services would be helpful and appreciated for any population. Consider the unique culture of any group you're serving, what they've experienced, and how this has affected their values and beliefs about health and healthcare, and the roles they expect friends and family to play in their care moving forward. So, as I mentioned earlier, providers need to have the skills to ask good questions, which means creating a shame-free conversation. For example, by reassuring all patients that it's okay to feel confused or not have all the answers about their health. For many patients, the data shows that communication with providers feels intimidating or risky, so providers need the confidence to put themselves and their patients at ease. And in a system so focused on efficiency, we often lose sight of the person who's being cared for. While many healthcare providers and software programs emphasize yes, no questions that provide quick black and white answers, the stories patients tell about their health can be revealing and can alter treatment plans and people's lives. So far, I've focused on interpersonal interactions, but I'm going to finish up today by suggesting some ways I see improving written interactions as well. So while there's a lot of strategies to make materials more useful to everyone, I'm going to focus on a few key parts of plain language, which is communication design so your audience can understand it the first time they read it. So when we talk about language, we're talking about patient-centric materials that avoid using complicated words, phrases, or abbreviations, and instead use familiar, everyday words that everyone can understand. It doesn't matter who they are, everybody prefers this kind of communication. These also focus on what people really need to know rather than what it would be nice for them to know. Remember, more isn't always better. So, for example, if an occupational therapist is creating a handout to help older adults learn how to avoid falls at home, it should focus on need-to-know, actionable information that helps people learn how to secure loose rugs around the house or choose an assistive device for the bathroom, rather than statistics and data about the number of home falls per year in the US or around the world. Now let's briefly address design. It's worth noting that good design is more than cosmetic. It can grab attention, increase understanding, and increase adherence to health instructions, which is essential. And it's not as hard to do as you might think. So whether we're talking about the cases and fonts that are used or avoided, to the size of the text, materials meant to create connections with older adults, for example, should be tailored to their needs. This means moving up to size 13 font to accommodate aging eyes, avoiding all caps and underlining, which can distort letter shapes, and recognizing small edits increase the likelihood that people will actually use the materials. As a final design recommendation, don't forget the importance of photos and images in the mind of your audience. These images should always focus on the grouping targeted and represent them the way they want to be seen. If you're unsure if an image or illustration will hit right with an audience, ask, consider running a focus group, and check in to get feedback. It's okay to have questions. At the end of the day, tailoring communication strategies to any audience has the potential to improve not only patient satisfaction, but patient health outcomes. People who understand their conditions, trust their providers, and follow healthcare advice live longer, healthier lives. Using health literacy strategies is just one way to get us closer to that gold star outcome.